Welcome back to Simply Women's Health with CJ. Today we're going to talk about the 5 W's and the 1 H of cervical cancer screening, also known as pap smears. So what is a pap smear? A pap smear is a screening test that is done to see if you have abnormal cells growing on your cervix. These cells can turn into cancer over time. Where is your cervix? The cervix this is your uterus. The cervix is at the very end of your uterus. It's the opening that goes up into the uterus. This is the endocervical canal. This is the vagina out in here. Why do we do pap smears? Because cervical cancer actually has no symptoms. Cervical cancer is caused by a virus, HPV. HPV is extremely common. 50% of the sexually active population actually has been exposed to the high-risk HPVs. If you want more information on HPV, please check out my HPV video that I have attached to this YouTube channel. Who gets screened? Any person who has a cervix after the age of 21 gets screened, and if you have a history of cervical cancer and you've had a hysterectomy, you too will also require pap screenings. When do we start? It varies between providers. There are a couple of different guidelines that are recognized. One of them is through the ASCCP, the American Society for Colposcopy and Cervical Pathology. Those guidelines are actually endorsed by the American College of Obstetrics and Gynecologists. For those patients, you start cervical cancer screening at the age of 21, not before that, at the age of 21. You get a pap smear every 3 years. If you have abnormal cells, they do what's called a reflex, and they look for the presence of HPV. After the age of 30, you get a pap smear regardless of the outcome. They DNA test the sample for HPV. If both are negative, you get a pap smear every 5 years, up until the age of 65. Like I said, unless there is a history of cervical cancer, in which case the guidelines are slightly different. The second set of guidelines that are recognized are those that were created by the American Cancer Society. Within the ASC, you start cervical cancer screening at the age of 25, and you get both a pap smear as well as the HPV co-test. And again, you get a pap smear every 5 years with those as long as everything looks okay. Where do you have your pap done? So most primary care providers can do pap smears. They can also be done in an OBGYN clinic or where you go to get your basic healthcare needs met. A lot of patients think that they had a pap smear when they were seen in the emergency room because they had a speculum put into their vagina. Most emergency rooms don't screen for cervical cancer. If you had a speculum put in, they were probably looking they were testing to make sure you didn't have some kind of an infection. But as a rule, emergency rooms don't do pap smear screenings. How is it done? Like I said, you'll go to your healthcare provider. You'll have to get your panties off. You'll lay on an exam table. They'll probably put your feet in some stirrups, have you scoot your booty down to the end of the bed, and then they will insert a speculum into your vagina. Speculums are not comfortable. Nobody likes a speculum exam. I tell my patients that all the time. If you don't like it, if you like it, I don't really want to be doing yours. When the provider puts the speculum into your vagina, it shouldn't hurt. There's probably going to be a little bit of pressure, a little bit of discomfort. If there's pinching, tell your provider they can bring the speculum out, go in at a slightly different angle, open the speculum up. Now, if you have a history of any kind of sexual assault or trauma and the pap smear is very scary or very painful for you, please let your provider know that that's part of your background. They can either refer you to somebody who specializes in gynecological care, or they can just make sure that they handle you with a little bit more special care. Once the speculum is in and your provider can visualize your cervix, they will take a spatula that looks like this, and they will go in down to the cervix. They will gather cells off the top of the cervix. They will put the cells into a cup, and then they will put in what's called a cytobrush. The cytobrush actually goes into the endocervical canal. So all the way up in here, it's going to go in here, and it's going to go all the way up into that endocervix. They'll spin that, bring it out, and get these cells and put these into a cup. Some providers use what's called a cyto broom. I actually don't have a cyto broom for demonstration because it just so happens they're on national back order right now. After the cells are gathered, the speculum will come out, and your pap smear will be complete. The results for your pap smear will be provided to you by your primary care provider. If you have more questions about what your results mean, please feel free to check out my video that talks about pap smear results. Hi, if you're still here, thanks so much for sticking around through the entire video. If you feel as though this information has been helpful to you, or you think you know somebody that might benefit from the information provided in these videos, please feel free to like it, share it, and if you haven't already subscribed, I would love it if you did that. Any and all support that you can provide is so greatly appreciated. As always, these videos were not created as a replacement for a visit with your healthcare provider, rather as a place for you to come for basic, reliable information that is non-biased and hopefully allow you to figure out what questions to ask your healthcare provider at your next visit to best meet your healthcare needs. Again, I appreciate all of your support. If you want to contact me, my information is at the top of this screen, and I will put it in the comment section of this video. That's all I have for today. This is CJ. I'm at your cervix.